Welcome. I'm Barbara Marcum, the Director of Senior Resources for the City of Westland, and today we have Dr. Cohen, who is one of Westland's own, part of Parkside Dental, which is right across the street. So welcome, Dr. Cohen. Thank you for being with us today.
Thank you for inviting me. I'm glad to be here.
Well, there are a lot of reasons that I really wanted to do this show. One was the fact that with COVID, so many people were unable to go to the dentist. Everything was closed down. So had they been not seeing the dentist for a year before then, it's been a couple of years since they've been to the dentist. We know that people don't always associate going to the dentist with good health. So I wanted to talk about that and some of the health issues and why it's important to see the dentist, even if you haven't gone in a while, which was my case. My parents have been sick. I've been out there every weekend. The last person on my list was me. So let's talk a little bit about that and what can people expect if they haven't been to the dentist for a while and they decide, okay, that's it. I'm going to start getting my life under control, and they make an appointment. So what can they expect if they haven't gone for a while?
Well, the first thing they could expect is for us to be non-judgmental, okay? I don't like to lecture people, make people feel bad. Everybody has issues in their life, and many times those issues take precedent, and they are number one. A parent who's ill, a brother or sister, or a child. COVID kept a lot of people from coming to the dental office. We were closed for, I believe, about 10 weeks. So when somebody comes and they haven't been, I have patients who come in, they haven't been to the dentist in 10 years. You know, no judgments. We just are glad that they are here. You know, we evaluate what's going on, come up with a couple different plans for them depending on how complex or how simple their treatment may be, and just get started slowly and get them caught up as quickly as we can.
Well, taking somebody where they are and addressing the things that are the biggest priorities would be, and that's a good way to start. But we also know that seeing the dentist or the lack of seeing a dentist can contribute to health issues. So let's talk a little bit about periodontal disease and heart disease. Is there a link there?
Well, there is a link. We're not 100% certain what the link is, but we do know that people who have active periodontal or gum disease are 2 to 3 more times likely to have a heart attack, a stroke, or another major cardiovascular event. It has something to do with the inflammation that is present in gum disease. And you know, there are a few different ways that it can cause heart issues or cardiovascular issues, but there is a definite link. And so we like to eliminate the gum disease and get people on an even playing field to eliminate the higher risk of cardiovascular.
Sure. When I was reading through my research, it was saying, that you can look at somebody's mouth and almost see their overall health, because it is a really good indicator about what's going on elsewhere in the body. What about diabetes? As far as periodontal disease and diabetes, what would be an issue there?
Well, one thing we know is that diabetics have a more difficult time healing from wounds, okay, whether it's a leg wound or arm wound or a wound in the mouth. And periodontal disease is basically an active wound that's going on in the mouth. So people who are diabetics have a more difficult time healing from periodontal disease. At the same time, periodontal disease is an infection. And we know that people who are diabetic, if they have a chronic infection, that affects their sugar levels. And so their insulin that they take or their body is making may not be as effective, and their sugar levels go much higher and much lower when there's an active infection. So when somebody is a diabetic, we need to pay special attention and try to eliminate all the gum disease, and sometimes that involves extracting hopeless teeth. But many times those hopeless teeth that are hopeless because of gum disease are in very bad shape, and there's a lot of infection around those teeth. And just by taking out a few bad teeth, we could really help to stabilize somebody's sugar levels.
Sure. What does periodontal disease or gum disease look like? If somebody, I mean, what are the symptoms? Can you look at somebody and automatically know, uh-oh, trouble? What are those symptoms?
Well, we can look red, puffy, swollen gums that bleed easily. That's kind of the number one sign of periodontal disease. Also, many times people who have periodontal disease have bad breath, and it's something that can be noticed by their family members. So if you have a family member who has chronic bad breath, you probably don't know whether their gums are bleeding when they brush or floss their teeth, but you may know that they have a breath issue. And many times that can be caused by a periodontal or gum disease issue.
Now, would decaying teeth cause gum disease, or would gum disease maybe cause the decay?
You know, decay and gum disease are kind of two separate.
Okay.
Decay is caused by bacteria, and gum disease is caused by bacteria, but they're two different types of bacteria. So we could have, it's not uncommon for a patient to come in, hasn't been to the dentist in 15 years, and they have no cavities, but they have terrible gum disease. And then on the same token, we can have somebody, a similar situation, hasn't been in 5 years, their gums are healthy, but they have root cavities and bad decay throughout their mouth.
Is there any genetic predisposition to having not very much enamel on your teeth or having periodontal problems? Can that be hereditary?
Definitely. There's a major hereditary component to gum disease. And I joke with my patients, it's like some people have a lot of hair on their head, some people don't have too much hair. It's genetic. Some people get gum disease and they could be brushing regularly, going to the dentist regularly, and gum disease can still develop. Patients like those oftentimes will send them to a gum specialist.
Sure.
And will rotate the visits. So they may come in 4 times a year for cleanings, and they may rotate every 3 months at the periodontist's office and the general dentist's office. But for most Americans, if you're coming every 6 months, and even if you haven't been in a while, if you get on a good pattern, we could usually control the gum disease pretty well.
Well, as people get older, there are some mental reasons, cognitive issues and things, where people don't actually brush as often as they used to, say like if they have like Alzheimer's, or they have where they forget to floss, or and then there are also physical reasons. So for those people, what types of things keep people from being on a good regimen every day?
Yeah, people who have memory problems, that's a big challenge. And hopefully a lot of those people have some aids, that help them.
Can help boost them and help
could
them
help
remember.
remind them, okay, brush your teeth in the morning, brush your teeth before you go to bed. Other physical limitations, people get arthritis, or they can have joint issues where they can't, move around, lift their arms so well. In cases like that, power toothbrushes are very helpful.
Okay, because yes, the manual toothbrushes, now that there are so many choices, then you have your electric toothbrush, and then you have your flossing toothbrushes as well. So which one's the best?
Well, that's a good question. Which one's the best?
Probably technique has a lot to do with it.
Yeah, personally, I don't know. I'm going to get in trouble with one of the reps who comes to our office, but I like the Sonicare toothbrush as far as a powered toothbrush. My wife has used it for probably 20 years.
And does that have the flossing as well inside?
It doesn't have
but it's
the
electric.
water flossing.
No water,
right?
okay.
But it vibrates, and basically you just have to hold it still against your teeth and just slowly, move. And it does a fantastic job at cleaning your teeth, removing plaque, and it even removes stain from your teeth.
Well, now that would be really good, because we know as people get older, receding gums can be a problem. So if you don't have to brush those gums as hard, you know what I mean? That would be a really good solution to that. We also have, as people during isolation, we saw a lot of people during COVID get really depressed. And depression is another thing that people can lose interest in their appearance, not just physically with hygiene, but obviously
that's
caring for their teeth as well.
Yeah, depression is a difficult battle that affects many people, and we just have to do our best to understand that it's a physiologic disease. It's not just it's not in someone's head.
I'm depressed because I've gained 5 pounds. It's actually, yes, it has to do with the chemistry of the brain.
Right.
So yes, and that's, you're right, it is a tough battle. I've seen a lot of people who were very depressed because of the length of isolation, because of the anxiety about not knowing what's going to happen, how dangerous is it. I can't meet with my family even, or my friends. So there were so many unanswered questions that I think it really, I don't know anyone who wasn't affected by it negatively. But now that we're back and going, this is one reason we did this show, time to get back to life. But let's talk about, when they talk about for example, things that are high in acid, and you see them on commercial, what are some foods that are high in acids, and why does that make a difference?
Well, the foods that we have to be most concerned with as far as high acidity are soda pops.
Even diet soda pop, right?
Yes. Those are the number one high acid foods that we take in.
Why is that? Because like, say you have a little bit of orange juice and then you put like a club soda in it. Is it the carbonation? What is it that makes it so bad?
That sounds really good right now.
I know, doesn't it? Well, that's my kids, that was all they were allowed for pop. A little bit of fresh juice and club soda. But would that be better?
That would be better. Diet pop definitely does still have acidity to it, but the 1-2 punch, the killer punch, is sugar and the acid. So things like Coke, just regular Coca-Cola or Pepsi, Mountain Dew, for some reason, we don't know exactly why, Mountain Dew is just the number one as far as, causing cavities and decay. And the way it works is there are bacteria that are in your mouth all the time that live on your teeth, and those bacteria produce acids. And when they have sugar or carbohydrates, there's about a 20-minute acid production. So I tell my patients, if you're going to have, they're working, some people like Coke instead of coffee for the caffeine at work. And I say, well, the best thing to do is, take your 8 or 12 ounce Coca-Cola, drink the whole thing in like 10, 15 minutes. And then say it takes 15 minutes, now you're going to have 20 minutes of acid production from the end of your drink. So you have 35 minutes. The worst thing you could do is take little sips every 20 minutes for 3 or 4 hours. Because then you have a constant acid production in your mouth that could be 4 hours long. And that's a common way that people really end up getting in trouble with carbonated sugar beverages.
Well, that makes sense. Okay, what about, for example, drinking water after? Okay, so acid, like would that include like maybe lemons or tomato? Those are high acidic as well.
Yeah, they are, but most people don't eat enough of that, for it to be an issue. Sometimes some people are almost attracted to lemons, and they're chew lemons, and they love lemonade, and it's like a lemon all day. Yeah, then it could be an issue. But having tomatoes or orange juice in the morning isn't really a problem.
Well, pop is really not good for you. It's really empty calories. So the best thing would be only as a treat on occasion.
Right.
Okay. Well, let's talk about cost as well. Seniors are concerned about cost, living on a fixed income. Right. And as you get older, I would guess just like anything else, there are more issues involved with longevity. I tell people, as far as cost goes, there's a lot of ways to spend money. But let's talk about the commercials that we see about dental insurance. And you see a lot of them, they say, oh, and there's no copay, and there's no this and that. And so for any procedure, what is your advice about the dental insurance you hear about on television? And what should people do, and what should they be aware of?
Yeah, it's difficult to purchase dental insurance if you don't have it through work. Now, it's becoming more common for some Medicare plans to give some dental coverage. And some will even give very good dental coverage. So, you could check with the person who helps you sign up for your Medicare. And when you're going through that, or when your renewal period comes up, you could say, what's available that has a dental option? It's important, if you have dental insurance, to have it with a well-known carrier. So unfortunately, when you see those things maybe on TV or, about, buy dental insurance for $2 a month, most dental offices don't accept, that type of insurance. Like, we work with all the major carriers, but not with really the small players that are, sometimes it seems like they are just kind of taking advantage, of the seniors.
Sure. Well, then an important thing would be, if somebody decides that they want to purchase that, is to call the dentist that you normally go to and find out if they're participating.
Right, that's the best way.
Yeah, or even, I guess you could ask the dental insurance, who are your providers? Who do you work with in my area?
Right.
If that's really an issue. Because, when you think about, we weigh things all the time and the way that we spend money. So when you think about, I'm not going to the dentist because it costs too much, well, you're looking at the monetary value versus not having dental care. So you're looking at all the diseases and all of the other things that's associated with gum disease and tooth extraction and all the decay and all of that. And it really, what is it called? What is the cost? It may be a lot higher on this end than the actual monetary cost that they're looking at. So I
Right.
always think that's really important because it is linked to whole body wellness.
Yeah, and many dental offices have, kind of introductory specials. So for maybe $99 at your first visit, you have, any x-rays you need and have your teeth cleaned and an examination by the dentist. And that's always a good way to start. And then also I know, we do, and also many other dental offices have in-house plans where, for, maybe $300 or $350 for the entire year, you have 2 cleanings and all the x-rays you need, examinations, fluoride treatments, and also receive a discount for any dental services that you need. And that's pretty common nowadays. A lot of dentists offer that because to help their patients who don't have dental insurance.
Sure. And I also tell people, it's like when mom and dad or grandma and grandpa get up there, it's like they get to the thing where they're downsizing. Buying things for their home is the last thing they want. So it's like, buy them a trip, buy them a dental exam, buy them, and don't be afraid to tell your relatives they don't know what you need. I'd like to go to the dentist. I haven't been there in 5 or 6 years, but I worry about the cost. And
Yeah.
have the family split the cost. I mean, as long as I would say the most important thing would be to check with your dentist and set up any plan that you want to do before you go in.
Right.
And then say, how can I pay for this?
But that's a great idea because, so here it is, Father's Day. Are we going to get another tie, another golf shirt?
Outfit, right.
Maybe your father or grandfather really would love to go to the dentist.
Yes.
Like you said, that's a great idea.
Yeah, so, just putting it out there.
I like it.
Okay, so when we have ways that we know to improve our dental health, we have, first of all, use a soft toothbrush.
Right.
What do hard toothbrushes, and I mean, there comes in soft, medium, and hard. Why wouldn't you want to use a hard toothbrush?
Hard toothbrushes can kind of exaggerate gum recession, because the gums are soft and fragile, and a hard toothbrush can cause excessive recession of the gums. And over time, it also could cause some notching to occur on the roots of your teeth. Just if you're brushing back and forth with a harder toothbrush, you can get these horizontal grooves on your teeth.
Oh, that makes sense.
And it's almost like cutting a tree down. It gets a little notch in it, and those can become very advanced, and teeth could actually break off, if they get too big.
Brush in circles.
Brush in circles.
Yeah. And if you brush your gums to help with the circulation, you can stay away from, that automatically gets your teeth, right?
Right. Yep. And your gums. That's a good way.
I pay attention. All right. And then, all right. And one of the things is clean dentures or partials every day. Why would that be important? Because they're artificial. Why is that?
Well, partials and dentures are made of a plastic material, and that plastic material is porous. And so bacteria kind of cling to the plastic and actually can grow into the plastic.
Oh.
So that's why it's important to, brush and clean. Usually, when someone gets a new denture or a partial in our office, we give them a new toothbrush for the denture. It's like an oversized toothbrush. And I tell people just use a little bit of hand soap and scrub the inside of the denture, run it under hot or warm water, and that will clean it, and then store it in water or a solution of a denture cleanser overnight. But it is important to clean the dentures and to keep them moist also, because of the porosity. If you let your denture dry out, it could change the shape. Usually it'll regain the shape once you get it wet again, but We don't like to take the chance.
No, and they're expensive. You want to take what's the difference between keeping them in the solution versus keeping them out? I mean,
Right.
there's no reason to do it. You know what I
Yeah.
mean? So,
And the other thing about dentures nowadays is they can be made so amazingly
real.
looking.
Yeah.
Like, I've had a patient who had a space between his front two natural teeth, and he ended up having to have dentures, and he said, can I have
I want my space.
Yeah, we can put a space between the teeth. A lot of times we don't line the teeth up perfectly straight. We tip one or tip two.
Yeah.
Sometimes we'll even put a notch in the end and the edge of a tooth so that it just looks totally real. And it's kind of fun doing, cosmetic
Sure, dentistry,
dentures
sure.
on patients who need dentures.
Oh, absolutely. One of the suggestions, it says rinse with an antiseptic wash, and that would be to eliminate the bacteria again. Drink tap water. People seem to forget that there's not fluoride in everything.
Right.
Fluoride makes a big difference when you have fluoride, and keeps it. Does it harden the teeth? How does it fight bacteria and decay?
Yeah, fluoride helps to remineralize the teeth.
Okay.
So if teeth lose calcium on their way to getting cavities, the fluoride can be incorporated into, as the calcium is taken back up, the fluoride can become incorporated, and it makes the teeth harder. So fluoride can be used to reverse decay, and it also, certain concentrations of fluoride are bactericidal, so they will just kill the bacteria. And one of the really exciting things, exciting for a dentist,
Yes,
that we have had in the last 7 or 8 years is there's a toothpaste that has 5 times the amount of fluoride. And it's not for children, but it's for adults who are having decay problems. Many times it's root decay. And root decay is caused by a different type of bacteria that causes regular cavities. But this toothpaste is very effective at eliminating root decay. I have a patient who's a friend of mine. He's like 82 or 83, and between ages of 70 and 80, almost every visit he had cavities, and sometimes there were cavities underneath crowns, and he had to have crowns redone. And he started using this toothpaste, and every day he uses it, and he stopped getting cavities.
wow.
And every time he comes in, we both talk about it, and he hasn't had a cavity in like 4 years now.
Can you get that over the counter?
No, it's a prescription toothpaste.
Good to know.
Yeah. And there are several different types available, but that is a great thing for people who are having decay problems.
That's wonderful. Well, I thank you so much for being a guest on the show today. I think we have some really good tips in moving forward after COVID, and seeing the dentist as one of those top priorities. So thank you so much for being our guest today.
Okay, thank you, Barbara, for inviting me, and you have a wonderful studio. It's very exciting to be here.
Well, thank you so much. And thank you, friends in the viewing audience, for being with us today.